I'm so happy to see everybody here today for our webinar between SODA, Student Organ Donation Advocates, and Donor Alliance, the OPO that's located out here in Denver. I am Sarah Miller. I'm the founder and president of SODA. I got involved with organ donation several years back when I started the first ever chapter of SODA, Student Organ Donation Advocates. We are a nonprofit that helps inspire students who are interested in getting involved with organ donation advocacy. It is so inspiring for me to be able to watch the students across the country who have been able to start chapters. I know quite a few of them are on the call today, so it's really awesome to see you guys joining in. And so, like I said, we're an organization that supports student organ donation advocates in partnership with local organ procurement organizations. We have 22 chapters across the country, and we work with more than 15 organ procurement organizations to support these amazing student leaders. I am located in Denver, Colorado, and I know we have folks from all over the country today. So while we do the introductions, I'd love if you guys could post in the chat where you're joining from. Before we turn it over to Anne, I'd like to do a quick introduction of our speakers today. We've got a really impressive group of speakers, starting with Anne Gaspers, who holds a master's degree in international education development. She joined Donor Alliance in 2016 after 18 years as a high school Spanish and adult English teacher. She manages the educational programs at Donor Alliance and works with the DMVs to make sure they have the resources they need to educate the public about organ and tissue donation. Jackie Bush will speak next. She is a current Regis University student in the MBA program. She graduated from Calvin Seminary and Calvin College with a BS degree in physics and biblical studies. She is currently a donation consultant at Donor Alliance for the past 5 years and previously worked with families of tissue donors as a tissue donor coordinator. Babs Kanakari is next. She'll be speaking about her experience as part of a donor family, something I relate with quite a bit. She's a donor mother from Denver, Colorado. She's the mother of 2 beautiful young women, and her 12-year-old daughter, Brianna, became a donor after a tragic accident back in 2010. And then lastly, Kyle Bishop will speak. He has been a tissue recovery coordinator for Donor Alliance for 5.5 years. He entered the medical field at age 18 as an EMTB, and then he transitioned to emergency room where he worked as a technician he worked there for 8 years. He earned his degree as a radiologic technician, and upon completion, began his current role with Donor Alliance. I think we're going to get a really good sense of how the donation process works throughout our webinar today, and we're really lucky to have these amazing speakers with us. I'd like to hand it off to Anne to provide a brief intro to Donor Alliance.
Thanks, Sarah. And thank you all for being here. It looks like we are in good company with many, many people who have experienced donation and transplantation either through their work or personally in their personal life. So these are the things that we're going to talk about tonight. We have, I'm going to go over who is Donor Alliance, and then Jackie's going to follow with hospital education and family approach. And she's also going to cover organ donation and recovery. And so that's probably the bulk of what our organ donation process is, but we also are including our tissue donation and recovery processes. And Kyle's going to go over that because at Donor Alliance, we collaborate a lot and to make organ and tissue donation and transplantation happen. And then we'll close with Babette's story of hope. So just to tell you a little bit about Donor Alliance, our mission is to save lives through organ and tissue donation and transplantation. And we do that by focusing on our vision of maximizing all donation opportunities. And we're very much a mission-driven organization. And our core values really are the anchor for which we do our work and how we accomplish that mission. Most importantly, our people first value. And I like to tell people that it doesn't matter whether we are putting that donor family first in the hospital who's going through a traumatic time, or we're putting a staff member who's been on a 24-hour shift first. We really work to put our people first in our organization. So just a little bit about who is Donor Alliance. We are one of 58 nonprofit federally designated OPOs, and we are also an accredited tissue bank. And so some of you might be thinking, 58 OPOs, there's only 50 states. That's because OPOs are federally designated with a certain service area, and our service area covers Colorado and most of Wyoming. We have the third largest surface area in the United States. It's largely decided about by population. So for example, Texas has 4 OPOs, California has 3. Correct me if I'm wrong, anybody who's out there listening, if I'd got that incorrect. The OPO out of Seattle, they cover Alaska, Washington, Montana, and part of Idaho. So it really depends on population and also proximity of transplant centers. Where are those organs and tissues going to travel to? So we do 2 things. We facilitate the donation process and we educate the public about what donation means. So this just gives you a little bit of information about our service area. We have 4 offices that are our pins here. Our main office is in Denver, Colorado, which is about half a mile from our recovery center. And I think Kyle's going to talk more about the recovery center because we transfer about 99% of our tissue cases to our recovery center. We have offices in Colorado Springs, Grand Junction, and Casper, Wyoming. And these offices are there as support to the consultants who work in those areas, and also in the case of Wyoming, to help support the public outreach that we do to educate the public. You'll notice that we do not cover these 3 southwestern counties in Wyoming. That is under the service area of the OPO Donor Connect out of Salt Lake City. But we do collaborate with Donor Connect to make sure that they have the materials that they need to educate the public in those areas. And we also work with the DMVs there, driver services. You can see that we work with over 100 hospitals in our service area, and we also work with the coroners in each county. So this is just a very brief overview of the donation process and how it works. It really starts with the diagnosis in the hospital, and I'm going to let Jackie talk more about that process. But even before that, right here before diagnosis, we in the PR department like to say that we educate and inspire the public, hopefully, before it gets to that moment in the hospital, so that anyone who wants to be registered to be a donor can do that before something might happen to them. So I'm going to kick it off with Jackie and go for it.
All right, everybody. Well, it's wonderful to see where you all are coming from. I love just seeing where you guys all are. And so welcome. Again, my name is Jackie Bush. I am excited to be here with you. Thanks for the opportunity. Thanks for your time. And you know, bottom line, what I want to share with you is really just that, that you can make a difference, really. And you know that's what we do with organ donation all of the time. But I want to inspire you to make a difference, you know, certainly by registering if you haven't already, which I assume probably most of our people have. But that's what happens with our donor families who are in those dark days and make a huge difference by giving that gift of life. But we can do it in little ways as well, since we're in a pandemic. And this is so I brought Baby Yoda with me because Baby Yoda makes a difference in my life, because every time I see this stupid doll, I smile, okay? So it just even little things, I'm gonna put him up here and we'll see if he falls down. But little things, little ways that you can make a difference in people's lives and put your gifts to work. So I hope you're inspired by what we do. You can go ahead and yeah, there's me. Go ahead and go to my first slide. I stuck this in there again, just because part of what I love about Donor Alliance is that it's an awesome company to work for. It's a mission-driven organization, and that means that everything we do is focused on saving lives. That's what we do, and it helps focus all of our activities. So again, even if you're a college student, a high school student, and you're thinking about, you know, what kind of an organization do I want to work for? I would be picky, is my advice to you. And because you should use your gifts, you should be in a place where you can flourish and make a difference and do excellent work. And that's what Donor Alliance has allowed me to do. and again, the integrity is a big piece of our business. If you want to think about it that way, nonprofit business. Um, what we do has to have a high degree of integrity because we have the public trust, and that's something we take very seriously. Again, all of the people I work with are pursuing excellence. And so being in a place where you can pursue excellence is something that I just want to encourage you all to do and to be. I also want to just note, as I get into some of the nitty gritties here, if you have a couple questions and they just come to mind, go ahead and just stick those in the chat. We're going to do questions at the end. And so just stick those in the chat and we'll get to those later. So without further ado, let's talk about donation. So the first big circle there is the population. Our service area, which Colorado and Wyoming essentially, has 6.19 million people in it. So again, this is just to try to give you a scope on what level donation happens on. So 6.19 million people in the year, and this is 2019 numbers for you. There's approximately 43,900 deaths. Okay, so 6.19 million people, 43,900 die. We get referred for organs and tissue donors. 3,000 people are like, maybe they're going to be donors for organs. 13,000+ potential tissue donors. And the next one, it shrinks even more because we begin to do some screening right away. And there's just, will they be able to give that gift? And there's lots of things that go into that screening process. So our actual potential from those deaths is even smaller, 300 maybe donors, organ donors, and 5,000-ish tissue donors. And then go to the last one, because this is where it all comes down. So in 2019, Donor Alliance, in our service area, we had 191 organ donors and then 2,118 tissue donors. So again, it shrinks. It is, it feels, for me, I deal with it every day, but it is a rare event that somebody is actually able to give that gift of life through donation. So it's a powerful thing. So go ahead and go to the next slide. What I do is I work a lot with the hospitals, and I love to teach, I love to educate. And so I get to do that every day and build relationships with, again, our people, our nurses, our doctors. And this is what I teach them. This slide essentially is how and when to call us. And I just tell them to call us whenever they have a question, but also especially, so for tissue donation happens after cardiac time of death. That's what that CTOD is. So tissue donation happens after a person has passed, and Kyle is going to tell you all about that. So I'm not going to steal his thunder. So I have them make sure they call us within 1 hour, that 60 minutes is there. For organ donors, we're looking for ventilated patients. So somebody who has had a neural insult. So something has happened, car accidents, all kinds of sort of traumatic things. Sometimes it's a stroke. Sometimes it's people who've had a heart attack and had a long downtime, and so their brain is not going to recover. So these are the kind of patients that I train the nurses to call us with. So within 1 hour of a GCS, that's a Glasgow Coma Scale of less than 5. If there's a brain death test, we want to know about that. If the family decides to transition their loved one to comfort care, just call us and make sure that we can't proceed with organ donation. Or if a family brings up questions, we always want to be available to families and just to answer any questions they have. So we really train our nurses, don't rule people out. And we tell everybody, don't rule yourself out, especially as I was a tissue donor. It's amazing what we can still facilitate in that gift of life, no matter how old you are. 104-year-old skin donor this year, something like that. Anyway, you're never too old. And medical condition, coroner involvement, even, you know, if there was a shooting that happened, we work very closely with our coroners and very involved with them as well. So again, never rule somebody out to be a donor, because again, we have to maximize that gift of donation. So that's good. Let's go ahead and go to the next slide. All right. So, and there's two ways to be an organ donor. Two pathways maybe is one way to talk about it. One is circulatory death. And that happens when a family says, you know, and the medical team, everybody's talked together and said, you know, there's no point in moving forward with treatment anymore. And they wouldn't want to live like this. And this actually happens in ICUs all the time, that patients are transitioned to comfort care. So once the family has made that decision, then we speak with that family and talk to them if we can, about potential organ donation opportunities. So that's a little bit more of an involved process in terms of, it can get tricky, I'll just tell you that, in terms of timing, because there's all kinds of lines we walk with our integrity. We don't want to suggest that we want to wait until the family's made that decision. We'll just put it that way. And then we want to have this conversation. And then often families want to be with their loved one until the very end. And so we do all kinds of things in terms of even having families go to the OR with their loved one and being there till the very end. So doing everything we can, again, to honor that gift and just to be there with the family as they walk this journey. So that's the circulatory death route. The brain death route is when a brain death, let me just give you, I'm going to read it so I get it just right. It's the irreversible cessation of all functions of the brain, including the brain stem. And it's really important that you, the public, that all of us remember that brain death is death. It can be hard to grasp, especially, I know my mom actually had a friend who was declared brain dead, and she just said his cheeks look so rosy, and you know, the ventilators moving his chest up and down, so how can he be dead? But it's that irreversible cessation of all functions of the brain, including the brain stem. And this is really important for families, especially because then they don't actually have to make a decision about withdrawing care or transitioning to comfort care. Let me just read you a quote from a family member. It says, "It means my husband died of his injuries and not because of a decision I made. I was having so much guilt about that." So that brain death declaration can be just a powerful gift even for a family to say, okay, they're already gone. And then we can move forward with donation in that case. So yeah, just brain death, it's a hard reality. Death is a hard reality, but there's a beautiful gift that can come sometimes. So that is how a person becomes an organ donor. Let's go ahead and go to the next slide. So our next step is just to have that conversation with the family. And we have amazing staff that will come to the hospital and speak with the family. This looks a little different in COVID, of course. Basically, it just looks like everybody has a mask on. We still do quite a few face-to-face conversations just because it's so important to us that the family understands what's happening. Often they're there anyway with their loved ones. So our family support coordinators will just come on site and just walk with them, say, you know, they always start with, you know, what do you understand about what's happening? Where are you? There's a lot of research that goes into our family support coordinator training about just how to give a grieving family information, because when you're in the midst of that grief, I mean, it just depends on where you are in your grief. If, you know, and people can be all over the place, whether they're angry or sad or, you know, but you're only taking in so much. I mean, that's true of all of us anyway, but then you add on that layer, that level of being in such a hard situation. So they're trained to really give them the information that they need, give them some things to take home, give them their direct line so that the family can reach out to that family support coordinator and really just get all of the information they need. And you know, on the bottom line, it is about honoring those donors' decisions and facilitating that gift of life. That's so inspiring to all of us, and such a beautiful, beautiful gift. So I'm going to go on to the next slide. This is sort of, you know, after they've talked with the family and it's time to go to the OR. This is picture. I just love it. It's called an honor walk, and maybe some of you have heard of these or experienced these. It's a beautiful way for the hospital staff certainly to just honor that gift of donation and have that culture that supports it, but also for the family, it honors them and honors most of all the donor who is giving that gift. You'll see it in the top there, there's a little heartbeat in a bottle. There's just little ways that our family support coordinators help them make memories, help them, you know, tell their story or begin to receive their story, even in those first moments. So, and we always follow up with our donor families as well. That relationship is ongoing, even, you know, beyond the donor's gift and into the next year or years, into the future, as appropriate. And again, every family is different, what their needs are different. It requires us to just be flexible and to just try to provide what's needed there. Good. All right, let's jump into the next section. So the family says yes, or the person is registered, and it's now time to medically evaluate and proceed with the organ recovery. So let's go ahead and walk through some of these slides. And it's amazing because we call them organ recovery coordinators. A lot of them have ICU nursing background. So again, if you want to be an organ recovery coordinator, you could become a nurse and then, you know, come on into the donation industry. But again, they work in all of our hospitals. And so they're always coming into a different situation. I believe we require at least 2 years of critical care experience, or paramedic or respiratory therapists or pediatrics. So their job is to help manage the donor, and you know, it's everything from you know, giving medications, making sure their metabolism is stable. They do a lot with what happens after brain death and all of the transformation that the body goes through during that time. And then also they begin the allocation process. So go ahead and go to the next slide. They're always in some ways just checking on the donor, making sure that everything is there to maximize the organ viability. So they think a lot about oxygenation and perfusion. So making sure those organs have enough blood, that they stay really healthy and really good, and even just maximizing their functions. There's certain things that you can do just to maximize an organ's function, depending on the organ, as we get ready for the OR. And usually, typically, families are in the ICU. An extra shortest I've seen is like 12 hours to 36, even to 48. That gets a little bit long there. But well, all of this is happening. So managing the donor, certainly maximizing those organ functions, and then also just the collaboration that happens, certainly with the hospital staff, with the doctors and the nurses at the hospital, throughout the Donor Alliance team, the transplant centers that we work with here in our service areas, so and across the country. So all of that happens. So go ahead and go to the next slide. UNOS, United Network of Organ Sharing, is a national database of sorts. It's highly regulated. and it's the list. We refer to it as, I'm sure you've heard it referred to as the list, the list of people who need an organ transplant. And so donor information is entered into that system, and that's matched with potential recipients. There's a scoring system that happens to evaluate how sick a patient is, and there's a priority given based on that system. Geography plays into this as well, and that's all part of how this system works. And again, collaboration is so important because ultimately, the crazy thing is that often the transplant surgeon, so the person who's going to transplant the organ, comes to recover the organ and then takes it back with them to transplant. That's what often, it doesn't always happen that way, but quite a bit that we see that happening. So if you go to the next slide, the coordination that our organ recovery coordinators facilitate in this is just amazing. They work so hard just to get the organ transplant surgeons into Denver and the OR scheduled. We do have an OR at our recovery facility, which is awesome, and we make a lot of use of that. But again, we sometimes have more than one case going on at a time. And so which OR are we going to use? Or are we going to use an OR at a hospital for all of our circulatory death donors? So if you're not brain dead, you'll be going to the OR at the hospital. So we'll be working with the hospital OR and the hospital OR staff. The donor family constraints. The recipients have to be ready to receive. So a heart, for example, can survive outside of a body for like 5 hours max. And so you can imagine somebody's got to be waiting to receive that heart so that once it's recovered, it can be transplanted. And so just amazing amount of logistics that they are coordinating, as well as making sure that donor is staying well perfused and well cared for. So again, amazing collaboration that happens in the whole process. So the next person who's involved are our organ recovery specialists, and these are amazing individuals. It tells you a little bit about their requirements there: bachelor's degree in life science, certified surgery tech. They essentially bring it all together in the OR. And so they deal with happy and grumpy surgeons and happy and grumpy everybody and just enable everybody to make sure they're communicating in an OR environment. And so that's always amazing just to see them, first of all, educating all of the OR techs, because it's not, again, 191 in all of our hospitals. And how many of those go to the OR in the hospitals? Not as many. So this isn't an everyday occurrence for the hospital OR staff, for example. And so they're educating them. They're making sure everything's set up, because the things that you need for an organ donation case are different than a normal surgery. So just phenomenal individuals who are doing this. And this actually, in this picture, you see them, I believe they're working with a kidney pump there. And so one of the things that we can do is we can put the pumps on, the kidneys on pumps rather, and they actually stay in a solution that keeps them more viable for transplant. And so we can pump those actually for up to 36 hours, is my understanding. So just awesome things that we're able to do to facilitate that gift and to make it as good as we can. So that's our organ recovery specialist. So that's another role that you could consider if you want to become an organ recovery specialist. I think I've gone through that pretty much. Where are we? Oh yeah, here. This is what we recover. It has the tissues on there too, but on the blue side, we just had an 8 organ donor. 8 organs were donated from one donor, which I was really excited about. It was actually at one of my hospitals, so I was super excited to be a part of that. But the heart gave the gift of heart, and then 2 lungs, liver, and sometimes we split the liver as well, 2 kidneys, small intestine, and pancreas. So those are the 8 gifts that can be given. And again, it just depends on the donor and sort of what, even the recipient list, sometimes it depends on if there's somebody who's ready to receive that gift. So again, there's a lot that goes into that, but really amazing. 8 lives can really be saved through that gift of life. So we also do imports. So we have a little bit of a hand as well in the when somebody is receiving a donor or an organ from a donor, we sometimes facilitate the transportation of those gifts. So that's all I have to say about that side. All right, that's the end. I'll pass it off to Kyle, who's my colleague. Actually, we started the same year at Donor Alliance. We were in the same orientation group. So take it away, Kyle, and teach us about tissue.
Great, thanks, Jackie, and thanks to Sarah and Robin for facilitating this. I really appreciate it, and thank you for everyone that's in attendance. I appreciate the opportunity. My name is Kyle Bishop. I have been a tissue recovery coordinator at Donor Alliance for a little over 5 years now, and tonight I'm going to be discussing the tissue donation process, as well as a couple of the key differences between organ donation and tissue donation. Then we'll move into a couple of our key roles within the tissue work system, and then we'll finish up with some facts about donation that might help put to bed some of the myths that we all hear going around. So, next slide. All right, so as you can see on these 2 process wheels, Jackie definitely went in very in depth on the organ donation process, so I'm going to say that we've covered that pretty well in depth. As you can see on the tissue side of things, we do have a very similar system in place of what's going to happen and what processes are going to take place prior to a tissue donation and recovery. As you can see there with the diagnosis at the top of the wheel for tissue, essentially that's going to be, as Jackie mentioned, a pronouncement of death. So at the time that an individual has passed away, either the nursing home, the hospital, the fire department, the sheriff's department, or the coroner's offices can all call in that referral to our TDCs. At the time of that referral, essentially we'll have a brief overview of the circumstances surrounding death, and then we'll try to immediately move into a registry check so we can see if that individual has been on the donor registry. If not, we'll begin to start making attempts to contact family so we can have a legal next of kin be able to authorize donation for that individual. At that time, since we've made contact with the families, we'll try and move into our medical social assessment. So that's where we can get a little bit better understanding of social histories and certain behaviors and medical risks that could preclude an individual from being a tissue donor. If the information we have available at that time and the medical social history has not precluded us from moving forward, we will then move to a process where, as Ann stated in the opening, about 98% of our tissue recoveries take place at our tissue recovery facility in Denver. So essentially we'll have our donor transported to our recovery center where our surgical recovery team will perform the recovery, and then that tissue is sent to our processors. So Ann, if you want to go to the next slide, this is where our key differences between, oh, sorry, just that there, perfect, thank you. This is where those differences between tissue donation and organ donation come into play. Whereas you can see our medical evaluation takes place on the tissue side after the surgical recovery. What that has to do with is on a tissue side of things, we only have typically 24 hours from pronouncement of death until we have to have our recovery completed. So when you think about the amount of medical information that one would have to go through to validate and verify all the information that we have at hand, that could take sometimes much longer than 24 hours. So what we have is kind of our big checklists, our big key hitters that we know are going to be essentially players that make an individual unable to donate tissue. So if we haven't had any of those big red flags, we then have our quality assurance team, our medical directors at both Donor Alliance and our processors going through that information and those records to where then if that tissue has been deemed viable, we are able to preserve it. And on that side of things with the tissue, a lot of tissues we're able to preserve for up to 5 years in cold storage. So these things will come into play where sometimes you'll have mass casualty incidents where, kind of like a blood bank of sorts, you'd like to have certain tissues on hand that act in a major way for healing and medical issues that can arise from, say, major burns, a lot of burn victims, mass casualty incidents, things of that nature. As far as our tissue donation, as Ann had mentioned, and Jackie as well, a lot of our organ donors are also able to be tissue donors. So in that case, especially if we have an organ recovery that is performed at our recovery center, most of the time our tissue team is able to perform our tissue recovery in tandem with our organs recoveries. So we do perform that quite often, and there are differences in what some people are able to be eligible to donate for an organ recovery, but not in essence being able to donate for a tissue recovery. And some of those things are understandable in regards to high risk individuals we might preclude from tissue donation because those tissue grafts that we're waiting for might not be as imminent to the life of a patient, whereas a couple months of time may be what someone needs to move into another possible double organ transplant. So there are some differences there. Next, we'll move into one of our primary roles of our tissue donor coordinators. This is where Jackie actually started when we first came on to Donor Alliance together. Essentially, these are individuals at Donor Alliance that will have our initial referrals called in. They'll take those referrals and do our initial workups of calling hospitals, calling coroners, kind of getting things facilitated to see how many different hats we have in the ring and how many different people we have involved and what responsibilities we have to honor the coroner requests, family requests, and reviewing our medical records. Our tissue donor coordinators also perform our medical social interviews. They also acquire authorizations from our individuals that were not on the donor registry, and they will set up transport and facilitate all of the movement that essentially gets an individual from the hospital to the point where our surgical teams are able to perform that recovery. As you can see here, we do recommend that a bachelor's degree in life science or EMT certification, healthcare background in some facet or social work. Jackie also came from a chaplain background. So there's quite a few folks that we've had from that arena as well. Already went into the responsibilities pretty in depth. Next, we'll move to our tissue recovery coordinators. This is the position that I myself function in and have since my time at Donor Alliance. Essentially, what our role is reviewing all the information that's been gathered up to the point where the surgical recovery will commence. So kind of a last check for anything that maybe we have some follow-up questions on, things like that. We also get into responsibilities of screening with our processors for acceptance of certain tissues, depending on age and medical history. And then we actually perform that surgical recovery of the tissues. We do, I wouldn't say necessarily a requirement, but a recommendation for a bachelor's degree in life science or some other form of medical experience, such as an EMT. And that's my background, came from an EMT background and an ER tech background. So now I think we'll jump into some facts about donation. Go ahead and hit our next one here. So as Jackie alluded to earlier, any age or medical condition can join the registry. So there's nothing that could preclude you from wanting to give the gift and make the wish of becoming a donor. As Jackie said before, I will correct you just a year. Our oldest skin donor on record is 105 years old, and our oldest liver donor was 91 years old. So, and also, as we had discussed earlier, with legal next of kin's performing authorizations to have their loved one be a donor, there's essentially no lower age limit as well. So there are some folks that have suffered some pretty terrible situations, but the thought of a young child, an infant, depending on circumstances, they still are able to have their child be a donor. So there's really no age or pre-existing conditions that can rule you out from wanting to be a donor. go to our next level here. As Anne alluded to, medical care is our top priority. So some of the scenes that you might see on like a Grey's Anatomy or a movie where you have doctors and physicians trying to actively not take care of an individual so that they could become an organ donor is absolutely not the case, and that is false. We're trying to help everyone, and the worst case scenario is finding yourself in a spot where you are that damaged and in that bad of a spot, because we want to help everyone as much as we can. We don't want anything to get to the point where you yourself could need a transplant or be in that situation. We respect our donors and our donor families. I can say that firsthand, regardless of the circumstance or the situation. Respect and our people and our donors first is without question our top priority. And I can attest to that by every day I go to work for anyone that's in our organization, without question. Next, open casket funerals are possible. There is no tissue that we recover, in no circumstance, in any way that we would preclude a family's wish to view a donor or view their family member by anything that organ or tissue recovery would alter an individual. Donation is a free gift. There is never going to be anything that, because of an organ or a tissue recovery, that causes the family and their family members to accrue a higher cost for whatever funeral arrangements that they had planned or are going to plan. There's nothing a family will ever have to take on financially because of honoring their loved one's wish to be a donor. And finally, all major religions do support organ, eye, and tissue donation. And next up, I think we'll send it to Babs. Thank you very much.
So I'd like to introduce Babette Kanakari. I said that wrong. Babette Kanakari. Babette is one of our advocates for life at Donor Alliance, and she's an amazing, amazing woman and a very loving mother. And I've heard her share her story several times, and I'm really excited to be able to have her share her story about donation with all of you. Babs, don't forget to unmute.
Hello, can you hear me? Well, thank you so much, Sarah and Anne and Donor Alliance for having me. I love sharing our story. It helps part of the grieving process. This is Spunky Brianna. You know, I never thought that I would actually be doing this. Brianna died tragically 10 years ago. I can't believe it. And she was only 12 years old. She just finished 6th grade, and she was 2 weeks into the summer. Unfortunately, she died playing the choking game. It's been around forever, but today our children are doing it alone with restriction. We did think it was suicide because of the restriction, but later on learned about the choking game. Sorry.
Take your time. It's all good.
I think what's hard now is because, you know, she's missed out on so much. But this little girl was very ambitious, an old soul. And when this happened, we were at Children's Hospital actually for 4 days. You know, we just wanted to give her every bit of hope to come through. Although, of course, the medical professionals, they already knew what her what was going to happen, but they let us hold on to hope as long as we needed to. Those days in the hospital, and I think when Anne was talking about the brain death, I started crying a little bit, because it's true. It's such a hard thing, because when she came into the hospital, of course, she was swollen, and there was so much stuff going on with her. And then I think by the third day, she just started looked like she was just sleeping. She was just like normal again. Her color had come back. We always called her our brown baby. Just her skin came back. It was so smooth. And she was actually taking breaths over the ventilator. And she was also able to get off of the medication they were giving her. So she was kind of in her own coma, I guess. So yeah, it was very difficult for us to like actually realize what was going to happen. But when they came in to talk to us about donation, I have to say something first. I have had a heart on my license. I probably since I got my license, and I never really got it. I never really understood. I mean, I knew what it meant, but it's never going to happen to us. We're never going to die, and we just take it for granted. And so the one thing that I do want to say first is, put that heart on your license and know what that heart means. Know what it's going to do. Know the gift that you're going to be giving. Unfortunately, if something happens to you, Brianna taught me really what that heart meant. So to move into that, she was well past me, because I think she was about 10 years old. Her and her dad were in a car accident. And thank goodness it was not, bad, but it was bad enough to where they had to go to the hospital. And I guess, I don't know the whole conversation between her and her dad, but it must have been when he was checking in or something, but she asked him what that heart meant on his license. And he told her, if anything ever happens to me, then I can donate my organs and help somebody else. Well, Brianna was only 10 years old. And at that time, she had said, Daddy, if anything ever happens to me, I want to help people. I want to be able to save somebody. So at the age of 10, she put it together. And I didn't put it together really until she passed away, of how special and how courageous it is to have that heart on that license. So when Donor Alliance came in to talk to us, I did not know any of this at the time. My husband had said right away, yes, our daughter will be a donor. I did not question him. I didn't ask any questions. I just said, okay. And I never would have thought that at the age of 12, we would have to give her wish, to go on and do something courageous. So many things have happened since her death. And really, when Donor Alliance says it, like, they're the best nonprofit or company, whatever you want to say, to work for, because I've had so many opportunities with them, and just the love that they've given our family. They know every family. We're not a number. We're not just like, after it's done, it's done. They are so compassionate and so loving, and are true angels on earth here. We had wonderful care with our nurse that helped us through the process of Brianna. I believe we were the first, and I don't know the medical terminology, we were the first family at Children's Hospital to actually be able to say goodbye to Brianna in the operating room. What was so beautiful about that is nobody knew what was going to happen. They didn't know how we were going to react. We didn't know what we were going to see. Um, but walking into the operating room, there was a beautiful quilt on Brianna's chest. There was beautiful music. There was these amazing people waiting to take care of our daughter. Um, and there was no time limit. There was there was nothing. Actually, I don't think anyone really said anything to us. Um, we got to sit with our daughter as long as we needed to. Um, we both told her how proud we were of her. Um, and to be able to give that special gift. And I'm so honored to be her mom. Um, it was so hard at the time because, sorry, I'm just so emotional. I guess it's the holidays or something. I don't know. um, so at the time, our other daughter was 17. And if you want to hear somebody talk, whoo, she's amazing. She had to be mom when all of this happened because I froze when all of it happened. We didn't allow her to be in there with her sister because we just didn't want her to remember that. But it was just amazing of the love that we received. So when we finally said we were ready, we left. We went back to the room, and I remember standing there just looking inside the room. Like, I couldn't believe that we were going to walk out of there without our daughter. But then I felt this presence behind me, and it was the doctor who was about to perform the operation. And he just said, "Thank you so much for your gift." And I just, like, he didn't have to do that. So I made a vow to Brianna. It was on our third night, I think. I told her whenever she's ready. And at that moment, I know she said to me, "Mom, if anybody can make a change, you can." And I've been able to be her voice. And I've been able to share so much of our story through Donor Alliance. I started a nonprofit right away. I went out the gate running. So it's called the Bree Project. We support mental health. We support the families left behind, risky behavior, the choking game, and suicide prevention. 5 years ago, my husband did take his life. So we got double whammied, but my mission is, and my passion is to do this. So again, I just have to say, if a little girl at the age of 10 can make such an adult decision and know what that means, then we all can do that. And we can all give the selfless gift of organ donation. And I want to thank my daughter for showing me really what it means. Thank you.
Thank you, Babs. Really beautiful. I think you just said it right there.
Thank you for having us.
So I'd just like to thank Sarah and Robin for having us on as their webinar this month. So we really appreciate the opportunity to share a little bit about what we do at Donor Alliance and also to share Babs' story and Brianna's story. If anyone has any questions, we're happy to take questions now. I think we have Sarah. Yes.
Yeah, we have a few minutes. If anyone has any questions, feel free to speak up or put them in the chat.
I think a lot of people, Babs, who are probably on this call or on this webinar are probably able to relate to your story, either as an OPO working with donor families or as a donor family themselves. So thank you again for sharing that. It was really, really heartfelt and helpful, I think.
Thank you.
We do have a question in the chat. How has COVID changed the donation process?
Kyle, do you want to take that one? Because I know you
Absolutely. Yeah, that's
experience.
so as you all could imagine, it's changed about as much as our job, as our daily lives have changed since March. So from a medical stance, we have had to deal with shortages of PPE, personal protective equipment. That term's probably synonymous now with most people, even outside of healthcare, and trying to get creative with our supply and our ordering. We've installed temperature probe stations, like little temperature check stations, where every day when we come in, whether it's a Donor Alliance employee or any outside vendors, we all have to have our temperature taken to make sure we're within normal ranges. We essentially, on the tissue side of things, we've had to perform COVID testing on all of our donors, which is something that was new for us. That's something we're looking for in medical records. And as far as the evaluation of individuals being candidates for donation, very similar to some of the CDC recommendations, we're looking at not only positive coronavirus tests, we're looking at close quarters with suspected individuals, people being symptomatic of the virus where we weren't able to perform a swab prior to death. Things like that have changed the game substantially.
I would add too, if I may, that just in spite of the changes, we move forward too. And I'm sure Kyle would agree with that too. Just one of the things that we say is the wait list can't wait. So, especially for those organ donors, we push forward. We don't do COVID positive donation, but we do certainly continue to move forward with donation on all levels, just because the need is great out there.
Absolutely.
Yeah.
Thank you for that, Jackie.
Yeah. And just to add to that, COVID, an active case of COVID currently, so if someone dies with an active case of COVID, that's a rule out, period. And as Kyle mentioned, if we cannot determine whether or not that individual, if there's suspected evidence that they might possibly have COVID or been exposed, it's also considered a rule out currently. It's important to note also that that might not be the case in the future. Hepatitis C was always a rule out, and it's not a rule out anymore, because we can transplant safely hepatitis C infected organs into recipients who, and then through the medications that they use to treat the hepatitis, it can be cured. So that, with medical advances in medicine, we are able to, we know that might change in the future, but it's too new right now. The other thing I would also like to mention is we've already surpassed, Jackie mentioned we had 191 organ donors who gave the gift of life last year. We've already surpassed that this year in spite of the pandemic. So we recovered our 191 first donor, I think 2 weeks ago. And as you can imagine, we've had donors since then. So we're pretty impressed, not just impressed, but really excited that our team is able to do that inside a pandemic. Any other questions? I'd just like to give a shout out to some of our staff members and advocates. I see you here, Faith, Emily, Dana, Terry, thanks for joining us tonight. We really appreciate your support in joining Soda's presentation tonight.
We're so glad that you guys all joined. I just want to say thank you again to the speakers, to Anne, to Robin, for all the hard work that you guys did to put this event together. And we look forward to seeing you guys all again soon. Thanks again for joining.
Thanks, Sarah.
Thanks, you guys.